All right, hello there. My name is Jenny Smith, and I am the External Affairs Officer at Newport Hospital and Health Services. Thank you, everyone, for joining us. Please give me a little bit of grace as we have people that are still joining. I'm going to let them into the meeting. So we'll go ahead and get started. Hopefully, everyone can see my screen. Okay. So thank you everyone for being here. This session is intended to provide factual information about Hospital Proposition 1. We'll be sure to try and get to everyone's questions at the end of the presentation. As this is a virtual meeting, it's a little bit awkward to interrupt our presenters when I get a question. So you can put your questions in the Q&A section. You'll see a bar at the top of your Teams, depending on how it's configured, that says Q&A, and you can put your questions in there. This session is intended to provide factual information about Hospital Proposition 1. Questions will be answered with factual information related to the proposition and the information presented. Because we're a public hospital district, those are our limitations. Similar questions may be combined and responses will be provided as time permits. We may not be able to answer every question during the session, and please do not include any personal health information or confidential information about yourself or others. And with that, I am going to introduce Kim Manus, our Chief Executive Officer, and Justin Peters, our Chief Financial Officer. We are also joined today by a few other members of our leadership team. Let me see here. It looks like we've got one more person. Jill, thank you for joining us. I was just introducing our Chief Executive Officer, Kim Manus, and our Chief Financial Officer, Justin Peters, and they're going to go ahead and get started with the presentation. But thank you, everyone, for being here. We'll be happy to take your questions at the end.
So thank you for attending. As Jenny indicated, I'm Kim Manus. I'm the CEO here at the hospital district. I wanted to talk a little bit about the fact that we are a public hospital district and what that means. The district was actually created in 1954, and it's owned by the public. And what that basically means is that we have a board that is elected by the voters in our district. There are 5 members on that board, and part of the board's role is to define and to provide guidance about what we want to be as a hospital district. One of the biggest things is that to maintain our autonomy and to stay independent, and also to be responsive to the healthcare needs of our hospital district. So we currently serve patients from birth to end of life. We do OB, and then we also have 2 assisted living facilities. One of those right now is being converted over to a specialized dementia care unit. We anticipate, based on a recent market assessment that was done, that we will have approximately 25,000 individuals that are in our service area by 2030. And our service area that we look at as being our service area is defined as being basically the Priest River, Priest Lake, Old Town, Blanchard on the Idaho side, and then, and of course, Old Town, and then up to Cusick, Usk area, and then to the, on the south side to the Spokane line. And that is growing. We are starting to see more people coming from a little bit further out than that, but that was the area that we looked at as we did our market assessment. And one of the things that's, as many of you are aware of, is that our community is, there's 30% of the folks that live here that are at a 65 plus population. And so therefore the healthcare is, it's important for us to be able to provide the services that are needed locally. From an economic impact standpoint, NHHS is one of the critical anchors within the community. We actually employ about 435 employees currently, and it's estimated that there is a $40 to $44 million in annual economic activity that is attributed to the folks that we employ here. So today we're here to talk about the fact that as we have utilized the data from our market assessment and with everything that's going on locally, that we are placing a ballot on the August 4th. The August 4th ballot will have a hospital Proposition 1. Many of you probably have received your voters pamphlet in the mail that came out, I think, here last week. The hospital proposition will allow us to expand and improve the emergency room. It will also allow us to update technology within the Newport community. One of the big things is being able to increase our surgical capacity. We've grown immensely in that area. And then we'll talk a little bit later about some of the new services that this initiative would pave the way for.
All right, welcome everyone. For those of you who missed it, I'm Justin Peters, I'm the CFO. So why do we need space? Well, we are growing. The ER, the emergency room last year saw just under 10,000 visits. That equates to just under 30 visits per day. We currently have 4 ER rooms with an overflow room that can house another 3 patients. So that's a lot of volume for such a minimal amount of space there. Our primary care visits over our clinic, we saw just over 35,000 visits in 2025. And then our surgical referrals are increasing despite only 1 operating room. Typically, when a surgeon does a procedure, they will operate in that room and then they can bounce over to another room that's already prepped and ready to go with a patient. Currently, our surgeons have to wait for that room to be cleaned and turned over, which is incredibly inefficient and doesn't allow us to fit as many surgeries in as we would like. So how is this currently impacting our community? Right now, we have some critical lab tests that are being sent to Spokane. We have longer wait times, especially for that specialty care. Our community has to drive to Spokane and Coeur d'Alene for specific care. And then also patients are delaying seeking care due to travel, which ultimately negatively impacts their health. So currently healthcare delivery is evolving. The hospital that is built in 1958 and 1993 was primarily built for inpatient stays. Surgeries used to require a night or 2 of overnight stay. If you have a total hip or a knee replacement, anything of the sorts, you would typically have to stay a night or 2. Now patients are going home the same day a lot of the time. So in 1993, we had 48% of our patients were outpatients. And when I say outpatients, those are your labs, x-rays, physical therapy, anything that you come to the hospital for and leave the same day. And then currently in 2026, that has moved to 88% outpatient. So the current structure of the hospital is just not built for the amount of outpatient volume that we're experiencing. So if passed, these are our proposed benefits to the community. First, we want to offer a medical bill credit for property taxpayers up to $750 a year to offset that new tax. Not only would we be able to offer that credit at the hospital, but we also want to offer that at Seabr's Pharmacy for prescription drugs. So also avoiding that 45-mile trip to Spokane ultimately helps save gas, less time off work, and more time with your family. We also want to keep care close to home. Again, avoiding that trip into Spokane, and improve access into our emergency room, surgery, physical therapy, and our lab. Faster results. Faster results for things such as microbiology. That's some of those lab tests that are being sent to Spokane currently. That lab test identifies bacteria and viruses, which fast results can be critical. And then improve patient flow. For those of you who've been in the hospital and had to have something done here, you understand that it is very compartmentalized. It is very hard to find a lot of the services. It's kind of been pieced together over the years. And so we're constantly helping patients find where they need to go. And if they're coming from the clinic, they enter on the basement floor, and all of those services are up on the main floor there. Instantly, we would have some job growth. Almost immediately, we'd have 20 to 25 jobs that we would hire for. And then over the years, we would be hiring much more than that. And then there certainly is an economic impact to expanding and being able to provide more services to the community. And then I'll let Kim talk about some of the new services that we're looking to offer.
So as a result of our market assessment that was completed, we actually looked at data to identify those services currently that are leaving our service area and are going elsewhere for those services. And the two main areas that we're seeing that is in the oncology and infusions, and then also cardiology, where those were the top two services that are leaving our area in order to have services provided to them. On the oncology front, we've actually started discussions with a cancer care center out of Spokane that is interested in partnering with us. We actually will be going to tour their facilities on Monday. They've expressed an interest in doing outreach in Newport and ultimately positioning ourselves to at some point to be able to do oncology here so that our community does not have to travel to Spokane for those services for the chemotherapy. Cardiology, we have added some services recently. We added an echocardiogram, but we actually have that located in our 58 building. It's not the best setup, but we've been able to bring that service and we've seen it's been growing fast. We need more space to be able to do more. Pain management is one of the other areas. We have, for those, I don't know how many of you are aware, but having pain management, talking to the needle injections that you have in your spine and that sort of thing. We've had several providers that have reached out to us that would like to come to Newport. Unfortunately, we've done some looking up in our OR suite area, and we just don't have the space right now to be able to accommodate that. We would like to have also an MRI suite in-house. We started out with a mobile trailer out in our parking lot, and we actually used to have them. They used to drive the trailer here, and they were here 1 week. They'd be here for 1 day, and then they started coming for 2 days a week. We found that we weren't able to keep up with the volumes that we needed to, so we actually now rent a trailer that sits here full time, but it comes with a rather large price tag. It's $38,000 per month. And we know that we could have if we had that unit in-house, within 2 years, we actually would pay for that unit just by having it pay for purchasing that unit ourselves. Another thing is our surgical availability. We have one OR room and a procedure room, but we can only basically utilize one OR. The OR room right now, we are orthopedic surgeon, for example, there's about he finishes a case, and then there's about a half an hour where crews come in and have to clean that room up to get ready to turn it for the next patient to come in. And so we lose a lot of efficiency. And typically what you see with a surgery suite is you have the surgeon move over to the next OR room while they're cleaning. He has started his procedure. And we have now 3 general surgeons that are coming here, a podiatrist and orthopedic surgeon. And we're also doing a lot of scope procedures, and some of our family practice doctors even are performing those. basically our OR for the most part is busy 5 days a week. And we are now also starting to see emergency surgeries that are taking place through the emergency room with that additional added coverage with the 3 general surgeons. It's busy. Emergency room space. We have, by the market assessment, basically demonstrated that we need to have 12 beds and then some behavioral health rooms. With the current 7 beds, it's a busy place. The behavioral health rooms are definitely a need for us. It's a growing trend across the United States. Patients that are coming to us in crisis. Unfortunately, our facility is not necessarily equipped to, we do not have what they refer to as safe rooms. What we currently have is what we refer to as safer rooms. And we basically, when we have a patient that comes in that has behavioral health needs, we remove everything from the room that they're going to be housed in. And with the exception of about the only thing that's left is the sink and a few minor other things. But the bed frame is taken out, the mattress is set on the floor. And what we'd like to see is some rooms that are actually dedicated to help us accommodate those patients while we're waiting for placement. Either in Spokane or Coeur d'Alene, and sometimes as far away as the west side of the state. It's not uncommon for us to have a behavioral health client in our facility in the ED waiting for placement for upwards of 3 days.
All right, so we are pursuing a $51 million bond up to a 30-year term. We do understand that this does have a cost impact on taxpayers. We're looking at about $1.47 per 1,000 assessed property value. When we went and looked at the home assessed values on average, we're looking right around $300,000. So we would be looking at $37 per month for those residents. Now, that's where we want to offer that $750 a year in credit towards your hospital medical bill here at Newport Hospital and Health Services, as well as being able to use it at Seaber's Pharmacy for those prescription drugs to really help offset that extra cost. Anyone change the slide there? All right, so here's our schematic design of what we're proposing. So one of the things I want to mention is that you see in the red area where the emergency room is, that's currently where the front of the hospital is. What we're wanting to do is move the front of the hospital to where it is facing the clinic. Just like I was talking about earlier, a lot of times when you go see your primary care physician, they will order labs, x-rays, PT services for physical therapy, and they walk right across, and right now they enter into the basement where they have to navigate upstairs. Moving the front of the hospital back there would be able to enter in on that basement floor. We would have area for patients, families to wait during procedures. So we'd have a waiting area. We'd have a central registration. So regardless of where you're going in the hospital, they can get you registered and then get you to the right spot. Up on that main floor, we would have a lab suite and then an imaging suite. That's where we would bring that MRI that's currently on the trailer. We would bring it in-house and have it on that floor. And then up on that very top floor there in the orange, that's where the surgical suite would be. So it would tie into where surgery currently is now, but with those 3 additional rooms, so we can increase efficiency and do more procedures. Then I'm going to go back to the emergency room area right there where the red is. That's not the full scope that we would be doing. So internally there, next to the red where some of the white is, that's where we would be renovating and expanding the emergency room. It would essentially be going from about 2,400 square feet to 5,600 square feet, doubling its size so that we could add those 12 rooms for better patient care. Anything to add, Kim, on?
No, probably one of the things for those of you who do go to the clinic, during inclement weather. Currently, we either have patients getting in their car and driving around to the front of the building to come in to get their lab work or their x-rays. What this would do is provide so that a covered walkway that you actually can get to the hospital and that you'd be right in that area where you can get those services. Coming in now to get those services is pretty confusing because you end up going through the old hospital and I call it the new hospital. You'll have to forgive me. I was here when we built the 93 building. So to me, it's the new hospital. That's probably infused. And I guess maybe just to mention that one of the spaces in that new section would also be where we would be doing our infusion and outpatient services. Currently, we house our outpatient services in our acute care area, and it's kind of tucked back in the corner because that's what the facility was built for. It was built more for inpatient than it was outpatient. And for those of you who are familiar, we used to have a waiting room. That's the glassed-in room across from the ED that has been converted over to being ED rooms. And so we're short on lobby space and also for our outpatient services, which continue to grow.
All right, so total project cost, we're looking at about $55 million, 51 of that coming from the community. So we would have a gap there to bridge, which we would manage through operations with our cash, certain leasing programs and grants. And then also we'd be looking towards the foundation as a potential investment in helping us get the project completed. Being a public hospital district, we do have limited debt capacity, so we cannot do this without the community.
Justin, we have a question real quick asking to repeat. Can you please repeat how many square feet is anticipated for the expansion? It says the white area on the concept diagram. Actually, that would be the orange area is the expansion, and then part of the complete remodel next to the ED. So do you know what the total expansion and renovation?
Yeah, I can speak to that. So the orange portion you're seeing there, it's roughly about 12,000 square feet per floor. So we'd be looking at 36,000 square feet there. And then we would be doubling the ED space, the emergency department space, which would go from about 2,400 square feet to 5,600.
And do you want to speak to the space for physical therapy and rehab services that would also be getting a new home that's separate?
So part of this is that we wouldn't want to interrupt operations during the construction. We want to keep all of our services going. So one of the first domino effects would be to move physical therapy out of the old portion of the building that butts up against the orange there. I don't know if you can hover over that, Jenny, or anything, but then all the way to the left side.
Sorry.
All the way to the left side there is where right now administration currently is. We would be moving physical therapy into that space. So then it would allow us to start construction in the space that they're currently in. So that would be the first domino effect. They would get a bigger space than they already have. It wouldn't be new space per se, but we would definitely have to get it up to their needs. All right. I think we're ready for questions. Anything you want to end on, Kim?
I don't think so. Just to take questions and see what people might be thinking.
So everyone, we do have a Q&A section. I know some of you joined a little bit later. So if you have a question, please go ahead and put it in the Q&A section, and we'll see if we can answer that for you.
Justin, do you maybe want to speak a little bit to, I think one of the important things is I was doing some research on the 97 building that was built, the new hospital. And at that time, our gross revenue was $10,000 a year.
$10 million a year.
10 million, I'm sorry.
Yeah.
Right. And last month,
Yeah, so $10 million for the entire year in 1997. And just this last month alone in June, we did $10.2 million in that month alone. So that is incredible growth from there until now.
and one of the reasons that we have seen a lot of the growth is attributed, as we've really seen the growth happen in the last couple of years because we opened up the express care that is located out of the clinic. We saw volumes in that area alone go up about 17%. But along with that, by having that walk-in service Monday through Saturday from 7 to 5 p.m., that volume has also impacted all of our outpatient areas. And that has definitely been an attributing factor.
So we have another question. This is a great question. Since patients outside the district would benefit from the expansion but would not pay that property tax, how would they contribute toward the cost of the project?
Yeah,
Well, yeah, go ahead, Justin.
Yeah, so is the question that how can they contribute that because they live outside?
It just says since patients outside the district would benefit from the expansion but would not pay the property tax, how would they contribute toward the cost? So I think this would be referring to maybe our Idaho neighbors.
Yeah, no, that is a great question. So they're one of the main ways to help is to reach out to our foundation if you're interested in helping with this expansion. And then for the residents that are paying those taxes, that's why we understand that they are going to be taking on the tax burden that other residents in Idaho will not have. So that's why we would be offering that $750 credit. But if you do live in Idaho and you are interested in helping, reaching out to our foundation would be a great way to help.
And we also have another question. I apologize, I missed it earlier. What percentage of patients come from outside the hospital taxing district?
Well, that's a great question. Kim, do you know that off the top of your head?
I know
Outside the
that
district?
35, I do know that about 35% of our business does come from the Idaho side. Boy, a lot of the other business, what we're seeing is folks that are coming, that are traveling and going up to Priest Lake and that sort of thing. I guess probably as you ask the question about how Idaho residents those residents are contributing to the project, probably the best way to how I look at it is that Idaho, they don't pay taxes, but they have been a big part of our success as far as being able to offer the services that we have been able to bring to the community. With the volume growth, with volumes comes the ability to bring more services in because it's much more efficient. And that's probably the best way to look at that, is that it allows us to grow and to have more local availability. We are finding that with services going to Spokane, for example, I just spoke with somebody that literally needed to get a physical therapy appointment for more of a specialty therapist. And the waiting time for that is until December of this year before that individual can get in for an appointment. And right now, our physical therapy area has about a 5-week waiting period. Our goal will be to double just about in size, probably that ability to be able to see more people and to get them in so that they don't have to travel to Spokane. And probably the other way I can tell you that Idaho contributes is that a number of the people who take care of patients out of our facility are coming out of Idaho. I mean, a part of our 430 employees are Some of those employees are coming out of Idaho. Our surgeons are coming out of Idaho.
Okay, we have some more questions. Thank you, everyone, for putting these in here. Really appreciate that. How was this growth plan developed and determined to be the best option?
Yeah, so the growth plan was developed really by getting that market study assessment. So we started there to understand what patients were leaving the community to get care elsewhere, whether it was because we didn't have space or we didn't offer that service. So that's kind of where we started. We also knew some of our pain points. I mean, right now in our lab, they're unable to update some of the equipment just because some of the infrastructure can't handle the higher voltage. So we started with the market assessment study, and then we just started knowing what our own pain points were, started meeting with architects, and just really had a whole workshop with the team over, a year or so period, and really identified where we wanted to grow and where the biggest opportunity was for the community.
The other thing I think that's important to mention is that our providers, our physicians, and our PAs, they absolutely were involved in looking at and identifying the needs for the community.
Great. We have a bunch more questions here. How was the proposed $750 annual medical bill credit calculated, and who would qualify?
Yeah, so the $750, we understand that there's still a bond out there right now. So what we wanted to do is increase that credit limit to, again, help offset any new taxes that you'd be seeing. So that's kind of how we had a conversation around it and came up with the $750 that would cover most of the property's assessed values and their new tax burden.
And basically, you could have about a $500,000 home assessed value.
Mm-hmm.
And you would, if you use our facilities and you have out-of-pocket expenses, you would be eligible to get pretty much dollar for dollar back on your taxes. And one reason that we're able to do that is that we are not really this bond is not about operations. We actually have been doing well as an organization. As far as the operational side goes. But what it's doing is it's a long-term investment in our community to be able to grow our services and to keep them local. And we're just seeing growth.
Yeah, and to add on to the end of part of your question there, who would qualify? If you pay taxes in the district, then you would qualify.
And in fact, we had one member ask us this morning when we were at a presentation if they were an individual who does not vote here, would they be eligible, that they have property out at Diamond Lake? And absolutely, they are eligible for that if they're paying the taxes. And it's a relatively painless process to be able to do that. It's filling out a form. And it's easy for us to look to see what taxes you've been paying, and that as long as you're current on paying your taxes, and it's pretty easy to look it up on the website for us to know how much you're paying in taxes.
And a follow-up question to that, will the medical bill and pharmacy credit continue for the full 30-year life of the bond? And is that commitment legally guaranteed?
It would be for the life of the bond.
Yeah, that's the plan. Yes.
What safeguards are in place to keep construction costs from exceeding the $55 million amount? Justin loves this question.
Yeah, that's a fantastic question, actually. So I went through an expansion at a different organization previously, and there are different delivery methodologies for doing an expansion of this magnitude. One of them is being a progressive design build. What that is essentially you have an architect and a contractor that want to come to be part of the team, and they would be on the design team, and they would come under one contract. So the contractor and the architect would work very, very closely together, and they would be, whoever we chose would be part of our team. Part of that progressive design build is there is a guaranteed maximum. So after 60% of the design phase is done before any construction begins, we come up with a guaranteed maximum price regardless of inflation, and it puts more risk on the contractor and the architect themselves. So we would not sign off on something if it was not within our budget. We would get it to that guaranteed maximum price, and then we would be able to pursue it there moving forward.
And I think another part of that question is delay costs and the fact that estimated escalation is about the cost each year that's delayed. You're looking at about $5 million to add it to the project cost for each year. To tell you our, in fact, I have it right here, our, the 93 building we built for $7 million.
Thank you. We have some more questions. So what architecture firm were involved in the study that helped develop our stacking diagrams?
I take this, Kim.
So Blue Room Architects were actually involved with getting us to this point. We did not spend a lot of time with getting down to detail. And the reason for that being that there have been instances where folks have spent upwards of $1 million to do the detailed. We figured out what we needed for size, for square footage, and what we needed in that building. But the actual getting to the point where it's like, we know what we want on each floor, but we have not gone to that detailed level. And so part of that process that Justin just talked about, that progressive design build, is that we will actually be going out for we will have a proposal that'll go out, and we will do interviews, and it will be a team that will come to us and do their presentation as to allow us to select the most qualified candidate.
Which we've had a lot of interest,
Yes.
Them reaching out, joining these types of sessions. So there's a lot of buzz around it, and people are definitely interested.
And when would residents likely begin seeing expanded services?
Well, right now we have kind of a pre-construction timeline. That would begin likely around April, May of 2027. As far as when the new services would be in, that's difficult to tell at this moment. I mean, it would be about a 3-year project. That being said, it would be done in phases. So just depending on during those meetings, what phases we did first would be really the answer that we would get at that time.
And in reality, physical therapy would be that we would see an enlarged area for that, because that department has to move in order for us to tear down the one section. Those of you that are familiar with where physical therapy is housed, they're in the old acute care wing of the 58 building. And so that is the section of the building that would come down to allow us to butt up the new building up to the 93 building.
Okay, thank you. I've got some more questions here. These are fantastic.
Mm-hmm.
Which services currently require the most patients to leave Pend Oreille County? Which new service do you believe will have the greatest impact on local residents?
I think the number one, if I recall, I'd have to look, but the cardiology is a biggie as far as it's leaving our area for services. And then the next one there was oncology. Those two areas were the most significant as far as leaving our area, and quite frankly, physical therapy. We were really surprised. We have a very, very busy physical therapy, and the fact that we found out that we're actually only capturing at our physical therapy about 35% market share, and that there's room for growth and to have folks stay here. And that's counting people that are going to the other physical therapy within. We have one in town, I think, out at the campus. And it also is one of the things that we did as an organization. We have been very cognizant of the fact that we do not need to duplicate services that are being provided elsewhere. And we've been working with the providers out of those we don't want to, there's no reason for us to do something twice. And a good example of that would be New Health has their dental available to the community. It doesn't make sense that that would be something that we would invest in. We're meeting that need.
And if grants or donations are received after the bond is approved, would that reduce the amount borrowed or lower the tax burden on property owners? Great question.
Yeah, I mean, I wouldn't anticipate we would get approved for any grants if the bond was passed, because they would only assume it would also allow us to bridge that gap. But that being said, Kim, I mean, what are your thoughts on that?
I hadn't thought about it. I think that's a great question.
Yeah. Let us get some more
We do
information
have-
on that.
Well, and we do have capabilities with bonds to go back out into, but you do have to keep them in place for a certain time period before you can actually go out and do a refinancing on them and reduce the time frame. And that's part of the commitment to people that are investing in the bonds. And they typically are buying them, some of them are short, like a 2-year bond, 5-year bonds, 10-year bonds, and because they are tax exempt bonds. And I know in '93, when we built the building, we actually had a number of individuals that requested the opportunity for private placement and to being able to buy those bonds.
All right. What is the single biggest problem this expansion solves? If Proposition 1 does not pass, what projects can still move forward and what cannot?
The single biggest problem that it solves is our space and our ability to grow. I mean, Kim talked about it a little bit, is that we literally are using almost every single inch of this space that we currently have. And a lot of it too is infrastructure. Like I was talking about with the lab, we're unable to even upgrade some of the equipment due to the capacity that it currently allows. So if this bond does not pass, we did look at doing just the surgical section first, but that caused many other problems that was even more concerning, because what would happen then is we would put a lot more strain on all those other services. The more surgeries you have, the more physical therapy, the more labs that are going to be ordered, imaging. So what would we be able to do? We really would be maintaining. We would get creative, I'm sure, but there's no real solid direction at this point.
And do you anticipate needing additional major construction or expansion during the 30-year life of the bond? If so, could taxpayers be asked to approve another bond before this one is paid off?
I would be surprised. I can't speak to something that would happen 25 years in the future. One of the things that this will do for us is that as we do need to have other needs to add onto the building, for example, were the cancer care to grow to the point that the organization that we're talking about partnering with, that we would see that the need was greater. Operations, the fact that we will have enhanced, we will gain efficiencies, which in turn will bring money to the bottom line, which will allow us to reinvest back into the community with improvements in our building. For the benefit of the group, our clinic was actually built and completed by the hospital district out of our funds. We did not go to the taxpayers for that. And I would see similar type opportunities as we grow.
Yeah, I would anticipate that exactly what Kim said, is that we would really like to see us be able to increase our operations and increase our bottom line so that we can do a lot of these projects ourselves. This would be the biggest part of the expansion that we would need to do. This really allows us to grow, and then we can start doing smaller projects from there if needed, and manage those with our own revenue would be our ideal scenario.
Thank you. How much hospital revenue currently comes from patients living outside Pend Oreille County? Do we have those figures readily available?
Well, we know from Idaho, it's about 35%.
Yeah, but Pend Oreille County in itself, we could get those figures, but I don't have those off the top of my head here.
Yeah, we would have to run some reports on zip codes and that sort of thing, but
Yeah.
we can get that data.
Yeah, we certainly can. Great questions.
I think you answered this one already. What happens first if voters approve the bond? I think you kind of covered that in talking about the percent.
Yeah, I think we talked about what as far as the phasing goes, but internally what we would do is we would have to start advertising to get a contractor and architect on board, and we would begin those interviews. And once we got that team established, then that's where the work would begin to get more down to that detailed level of exactly what's going where. And we would be involving all of our leadership in that. All of the directors and managers throughout the departments, they would have say in exactly how their department looks, since they know their department better than we do. So we'd get down to that granular level at that point.
And with the providers also.
Yeah.
I don't know how many of you are aware, we actually, out of our clinic currently, we have 22 providers that are working out of that clinic. It has grown immensely from when we first built that clinic. And that, again, that is part of why we are so busy. And we have not ever had a problem with recruiting providers, which has been nice for us. We participate with the University of Washington. We have residents that come through. And in fact, the last 3 doctors that came to us and that do family practice OB are actually went through that program. 2 of them actually came here and did rotations. And then they called their friend and said, you need to come to Newport. We also started out, we had 1 LICSW that we started in the clinic a few years back. Then we went to 2. Their waiting list was growing. We now have 3 licensed social workers that are actually that offer behavioral health services, which is really a nice model for our family practice to be able to, that the patient gets their total care when they're here.
I have another great question. It's funny, somebody just asked me this today. Who paid for the electric vehicle charging stations currently located at the hospital, including their installation and ongoing electricity and maintenance costs? Were those expenses covered by grants, hospital operating funds, taxpayers, or another source?
Okay, well, Jenny, let's let you answer since you wrote the grant and did all that work with the PUD and.
Yeah. Okay. So actually, that is kind of an interesting story. We were getting ready to expand our parking lot anyway. We knew that the old house that used to hold our accounting services was going to need to come down, and we needed to expand for those parking spaces. Out of the blue, we received a phone call from a company called EV Charging Solutions. They in turn were working with Energy Northwest and the Washington State Department of Transportation on a West Highway 20 project that had received, I think it was federal funds, to install EV charging stations all across that Highway 20 corridor, clear across the state. And because our hospital is less than a mile from Highway 20, they called us up and said, hey, we've never put these at a hospital before as part of this grant. Would you guys like to be considered? And I said, what? Like, what's the catch? Anyway, and so no, that project was fully paid for by a grant, and they cover all of the installation, the ongoing electricity and maintenance costs. We have to kind of make sure the area is plowed, let them know if there seems to be anything wrong with that stuff. So we kind of babysit that area. And then we do receive a small percentage of the of the charging fees when those come through. So no, we didn't pay for that. It just worked out. one of the things that we had heard through the state was that once we were looking into other expansion plans, that we would be required to have so many EV charging stations, depending on the number of parking spaces we increased. So we were just trying to anticipate that, and it just happened.
And the PUD was definitely instrumental in working with us to make that happen.
They were outstanding. It was a big ask from them. Are you targeting the September 24th PRC session for progressive design build approval through Washington State? And do you anticipate the RFQ for design build services released shortly after in October? Something tells me this person's an industry partner or friend.
Yes, we are. September 24th is the PRC session that we are going to present at to get approval through Washington State. Do you anticipate the RFQ for design build services released shortly after in October? Yes, we hope to find out very shortly afterwards if we were approved. We did bring on a consultant onto our team to help us through that process, and they have a 100% success rate. And again, they've said that there's a lot of interest in this, so we anticipate a lot of different partners will be there on our behalf.
And I find a question that I missed, and I apologize for missing this earlier. Good question. As the community considers this investment, what opportunities exist to leverage the facility beyond healthcare services to support broader community needs and enhance its long-term value for taxpayers? And it says community spaces. I mean, I could say that I know one of the things that we are planning on doing is more community education if we've got space to do it in. And so having that kind of opened up lobby area does allow us a little bit more opportunity to provide more community education, similar to what we've been doing in our Ponderosa room these last couple of years. So that for sure.
That was my thought too, Jenny. So.
Yeah.
Thank you. Sorry it took us so long to get to that one. I'm scrolling. You guys are amazing. Thank you for all of these questions. So one of the things that I wanted to point out, I don't see any new questions, but in the Q&A, I did publish a post that we do have an email address that you can specifically ask some more questions. If this conversation kind of gets your thoughts going and you come up with more questions at 3 o'clock in the morning like we do, you can go ahead and email us and we'll get back to you with as much information as we can provide at this point.
And to piggyback on what Jenny's saying, going out and having our community meetings, we've gone and met with different groups. We've had a number of really great suggestions. One of those was actually including the Siebers pharmacy in that ability to use those, those who are paying taxes to be able to use it for pharmacy. And what was pointed out to us is that, some of the younger patients don't necessarily, they have a good health insurance coverage and they're not paying a whole lot of anything out of pocket necessarily, but that there is a gap on the pharmacy. And that is also an area that we know for our Medicare patients, that there is that donut hole, that there's that amount that the beneficiary has to pay out of their own pocket, and that hopefully that would help with some of those amounts that are needing to be paid.
Thank you, Kim. All right, well, I don't see any additional questions. Really, really appreciate you all joining us. Obviously, you have our hospital expansion at nhhsqualitycare.org. I put that in the Q&A. You can also go to our website and find our contact information. You can call the hospital operator and ask for Jenny Smith. if you want to, and I can get you in touch with the right people if I can't answer your questions. But we do thank you for joining us. Thank you to the rest of our leadership team who is on this call and our board member, Becky Walrath, who joined us well. We hope you all have a wonderful afternoon. Oh,
I do want to mention that there is also a video out on the website that actually does cover what we're doing with this project. For those of you that might want to share with your neighbors.
all right. Thank you, everyone. Take care and
Thank
have
you so much.
Thank you, everyone.
wonderful
Appreciate it.
evening.